to the consulting room. Today we are going to have a very interesting discussion. It's a topic that we hardly ever come across. We are going to talk about oral health. And I have with me here Dr. Jima, who has a lot of experience in this field and is going to help us dive into it. But before that, I'll give him the opportunity for him to introduce himself. Afterwards, we'll take a short break and then we'll resume. Dr. Jima, please, you are welcome to the consulting room.
Thank you.
Please, can you briefly introduce yourself to our viewers?
So I'm Nana Jima. I'm a dentist. Been practicing since 2013.
Okay.
So that should be about, my math is poor, help me out.
About 12 years.
12 years, yeah.
Wow.
I have specialized in an area in dentistry called oral and maxillofacial surgery,
Okay.
which deals with congenital diseases, trauma, cancers of the mouth and the face, that sort of thing.
Okay.
And I'm happy to be here today.
And we are glad to have you here. Okay, so we'll take a short break, after which we'll dive into the details. Welcome back. The topic of discussion today is oral health, and the special guest who is taking us through it is Dr. Jima. So Dr. Jima, before we dive into the specifics, can you tell us what oral health is and why is it important?
Yeah, so when we say oral health, we are referring to health of our mouth, okay? Everything inside it, the teeth, the tongue, the palate, anything in there. But it also goes beyond that and comes out of the face too, and then a bit of the neck as well. So when we say oral health, our minds mainly goes to how to take care of our teeth, how to keep them clean and that sort of thing. However, it goes beyond that, and that's what I've just explained.
Okay, thank you very much. So today we are discussing about oral health. Do you think there are some specific reasons why this topic is usually neglected?
I think it sets in our cultural values, okay? We have proverbs that says that if your parents take care of you for your teeth to erupt, you should take care of them for their teeth to come out. That is to say that as people age, the longer they age, their teeth should fall off. But that's not the case. If you have good oral health and your teeth are healthy, you should take them to your grave. So deep set in our cultural values is the belief that we shouldn't take too much care of our teeth. Maybe because it's hidden until we smile. Maybe it's also because there are other pressing things, other more life-threatening diseases to deal with. And so emphasis hasn't been there. The other thing is that we also think of oral health as a problem of the rich. Okay. When you are struggling to put food on the table, who cares about seeing the dentist? So I think these are what may have contributed to us neglecting oral health.
Okay, it makes sense. So please, how does oral health affect the overall well-being of individuals?
So let me ask you this question. When you see someone, okay, what's the first thing you see about them?
Well, their physical appearance.
Yes.
But when they open their mouth, it's the teeth you see.
You look at their teeth and their smile. Yeah. You enter an office, a shop, and whoever is there smiles and you feel at home, okay? Yes. So it's so important to have a good smile. And a good smile comes with having nice teeth. Now, what if the person has really nice teeth, smiles nicely, but immediately they start talking, they give off some bad odor, you turn away, okay? Yeah. So this is how important oral health is to our overall health. It's like the gateway. If it was a company, we would say it's the receptionist that you would meet before you see other people. So it's extremely important and we need to take care of it because that is the gateway to other people when we meet them.
Okay, so please, what are the most common dental issues we face in Ghana?
So it's difficult to say which is one and which is two. So I'll put one and two together. And these appears to be the case in almost every country. The first one is dental caries, or we say cavities in teeth, all right?
In Tree, how do we call it?
Kaka.
Okay.
Yeah, so, but you see, kaka is a very interesting word because in Tree, kaka can mean several things, including toothache.
That's true.
Yeah.
That's true.
So when we say kaka or cavity or dental caries, it means that there's a cavity inside the tooth. And these cavities come about after bacteria that lives in our mouth normally. They are called normal commensals. They live there, that's where they live. Okay. But when you don't keep good oral hygiene, you don't brush your teeth, especially when you're going to sleep, that sort of thing, you leave behind food particles, and these bacteria would feed on it and produce acids as their end product, and these acids will cause cavities in your teeth. When it starts, it's not painful, so we don't give it attention until the infection gets into the core of the tooth, then it becomes very painful. That is one of the main things you see in almost every dental clinic you go to. Okay. The second one is what we group and call as periodontal disease. Now, periodontal diseases are diseases of the gum and the other structures that hold the teeth into the bone, anchors the teeth into the bone. So with the proverb I said from the beginning that you take care, your parents take care of you, you need to take care of them until their teeth falls out. Mm-hmm. What it means is that most elderly people in Ghana have periodontal disease, and they end up losing their teeth because they've lost those tooth supporting structures that keep the teeth inside the bone. Okay, so most of the time, these are what you see. Now, periodontal disease can range from gingivitis, which usually presents as bleeding when you are brushing, to dental abscesses, which will present with bad breath and all these things. So these are the two main dental diseases or oral health concerns that are seen everywhere, and the case is the same in Ghana too.
Okay, so how often would you advise us to see our dentists in a year?
So the recommendation is twice a year.
Okay.
That is what the WHO says. That is what the International Federation of Dentists also say. And we say that, you know, a year is 6 months. So divide it into, a year is 12 months. Divide it into 2, you have 6 months. So we say visit your dentist every 6 months. Okay, every 6 months. Now, this is for the person who has no predisposing conditions that would make them have oral diseases more often. This is for the regular person, the one who is not sick. Okay, we say visit the dentist every 6 months for a routine checkup. Then those who have conditions like, say, diabetes, which will affect your oral health and some other stuff, you need to visit more often than that, and your dentist would let you know how often you should visit. So every 6 months. Now this is very important. The reason is this. Most dental diseases, when they are starting, you wouldn't notice it. Okay. Yesterday I saw a patient who needed a dental procedure, and she said she wouldn't have it done because she didn't have any toothache. So in her head, once she has no pain, she shouldn't see a dentist. Okay. Unfortunately, most dental diseases, when they start, they don't hurt. They only hurt when they have reached the late stages. Okay. So if you are going to wait for pain to send you to the dentist, then you would go at a point where your disease is really advanced. And it's because of this that we say visit every 6 months, so that every 6 months we will check and we'll find out whether there are new diseases coming up. Some of these diseases are cancers, oral cancers. When they start, they don't hurt. And if you wait, by the time you find it, they may have spread to other parts of the body. It becomes really difficult to deal with them. The other reason you have to visit the dentist often is that, you know, let me give this example. If you have a car, you may watch the car yourself at home every now and then. But after a while, you may have to take it to where they wash, the car wash, the washing bay, where they have those water hoses that go with high pressure, okay? Or if you are in your house, you sweep your room every day. But once in a while, you need to move the tables, chairs, and sweep under them. That's exactly how the teeth are. No matter how well you clean your teeth, there are some difficult to reach places that your toothbrush cannot get to, okay? And so every 6 months, you need a dentist to do what we call professional cleaning for you and remove those kind of things from there. Those things are called plaque or calculus, and they are the #1 risk factors for periodontal disease. So if you are not visiting the dentist, you are not getting your plaque or calculus removed, it means that you are preparing yourself for periodontal disease, and it will happen sooner than later.
Okay. So please, what are periodontal diseases?
So periodontal diseases, like I explained from the beginning, are diseases that affect the structures that hold the teeth into the gum. I have this here. I'm going to use this to explain to you, okay? So if you look at this, this is a model of the mouth. So, of course, the white stuff here are the teeth. Now, the pink thing here is the gum. We've all seen this, okay? So when you look at it from the outside, what you see is that the teeth are set in the gum. Now, under the gum, you have bone. So the teeth are actually set in bone, and then the gum covers the bone. Why is it that when these teeth, for example, they are up here, they are in the bone, they don't just fall out? There are some structures that hold them in place, like a form of cement that you use to cement it, or glue, okay? And these structures, together with the gingiva, are what we call the periodontium. So if these structures get diseased, then you have periodontal disease. And if you have plaque or calculus, if you look into the mirror, you look very hard, you see sometimes some yellowish or greenish deposits at the edges of the teeth. They just sit on the gum. They are food debris filled with bacteria. So it's like you have a nice niche, a nice place for the bacteria to stay. And as they stay there, and then they go about their normal activities, they destroy the gum, then they'll go in and destroy the bone as well. Then the teeth begin to wobble. So the first sign of periodontal disease, your gums will bleed. When I was a boy, I thought if you bled whilst brushing, then you had brushed your teeth very well. Now that's not true. If you bleed whilst you brush, two things: either you are brushing too hard and so you are cutting your gum, or your gum is diseased, okay? And that's the first sign of periodontal disease. So if you brush and you bleed, you should immediately rush to the dentist, because at that stage, something can be done to prevent that periodontal disease from progressing. If not, it will continue, the infection will get to the bone. Next you know, your teeth begins to wobble, and then they may fall out. And that's like the really advanced aspect of periodontal disease, when the teeth start to fall out.
Okay, that's interesting. So please, let's talk about brushing. Is there a correct way of brushing the teeth?
Yes, there is.
And I have a follow-up question. And then with the brushing, the ordinary toothbrush versus the electric one, are there any differences when it comes to how to brush?
Okay, so let's start with what you need to brush your teeth. Then I'll tackle the electric one. Then we'll come to demonstrating, because I brought this here purposely I knew you would ask me about brushing. So let's talk about toothbrushes first. So when you are getting yourself a toothbrush, what we advise is that the bristles of the brush, now these are the bristles, okay? The part that does the actual brushing, they should be, the hardness of it should be medium hardness, or they should be soft.
Okay.
It shouldn't be hard.
Hard is a no, a big no.
Hard is a no. Okay, I'm told some people use toothbrushes to scrub the corners in their bathroom. Yes, that's what you can use it for, and their shoes, not for your teeth. Okay, because when you use hard toothbrush, it wears off your teeth, and with time, your teeth begin to be sensitive. You take cold or hot drinks, then you feel this sharp electric pain. passing through your teeth. That is tooth sensitivity.
Yeah.
It's a nightmare, one of the most difficult things to treat in dentistry, yet it's preventable. So don't use hard toothbrushes. Go for those that are medium bristle to soft, okay? That should be okay. Now, as to whether the brush is electric or manual, the most important thing is how you use it. Okay. Now, as a rule of thumb, the electric toothbrushes are somewhat superior to the manual toothbrushes. And when I teach you the way the brush should work, you understand, because you need to move the brush in circles. Now, the electric toothbrushes, the bristles move in circles already, and that's the superiority it has. Okay. Secondly, you don't have to be moving it up and down as much. The whole idea of electric toothbrush came up for people who have conditions that affect their manual dexterity. For example, someone has stroke, they are not able to use their manual toothbrush well, so electric toothbrushes came up. But it has gone beyond that, and now everybody can use toothbrush. People who wear braces, for example, the electric toothbrush is able to clean around it quite better. Okay, so electric toothbrushes are somewhat superior to manual toothbrushes. It doesn't mean that we should all throw away our manual toothbrushes and use electric toothbrushes, okay? If you are using your manual toothbrush and you are using it well, you are as good as you need to be. And even for the electric toothbrush, if you have it and you don't know how to use it, you are just wasting it, okay? So I wouldn't want to place too much emphasis on whether it's a manual or an electric toothbrush. What I would say is that if you can afford an electric toothbrush, go for it, it's good. If you can't afford it, don't worry yourself. But especially for people who have lost some amount of manual dexterity, like someone who has stroke or the aged who are not able to move as well as they would if they were young, electric toothbrush is the thing. So if you want to buy your granny a gift, for example, that can be a good gift, all right, an electric toothbrush. Okay. Then let's go to the toothpaste. There are several toothpastes on the market, and what is most important about it is that it should contain fluoride. The reason is that fluoride strengthens the teeth. Okay, now if you look at the tooth enamel and its chemical structure, okay, it has a hydroxyl ion that fluoride will go and replace. And once fluoride replaces it, it makes it stronger than how it used to be. Okay. So if you brush with fluoride-containing toothbrush, you make your teeth stronger. Some countries have even tried to put fluoride in water and in milk so that everybody takes it for this effect. Okay. But here's the thing. There are if you go on the internet right now and then you check, you find several people talking against fluoride. Okay. Of course, it can be poisonous. But when it comes to chemicals, all form of chemicals, the issue is with dosage.
Yeah.
How much fluoride is poisonous when you ingest it? After all, the toothpaste, we don't swallow it. We rinse with it, we spit it. We brush with it, we spit it out. Those who swallow toothpaste are kids. And that is why there are toothpastes specifically made for kids. And in those toothpastes, the fluoride content is very, very low. So that even if we are not saying they should swallow it, but even if some goes down into their stomach, it will not cause problem. Now, the amount of fluoride you need to have fluoride toxicity, you probably would have to take one whole tube of toothpaste and gulp it down to get that fluoride toxicity. So you see people talk about fluoride being poisonous. When you talk about fluoride in toothpaste and you say it's poisonous, you are taking it out of context. The amount is so small. Most toothpastes comes in 1,000 or 1,500 parts per million, which is a very, very safe concentration. Okay, so if you are using your toothpaste with fluoride, it's good because fluoride is going to protect your teeth. Aside fluoride, there are other things that may come in a toothpaste. Charcoal to whiten it, herbs to make the gum strong. All of these things are there. I always use the phone analogy and say that Phones are there primarily to make calls and send messages. Okay, so once your phone can make calls and send messages, it's a phone. But if you can afford a phone that has a camera, that's a plus to you. If you can afford a phone that can scan, that's a plus to you. But if someone cannot afford those, it's still a phone. So if you can afford a toothpaste that has all of these other things in there, that is all right. But if you can't, don't be too worried. The most important thing is fluoride. So far as companies will exist, they will market things and they will put in things to make their products superior to others. It's okay if you can afford them. If not, don't be too worried about them. Okay, so toothbrush and then your toothpaste. Now, how much of the toothpaste do you need? You know, sometimes we take the toothpaste then from one side. Actually, I have a friend who was in the university. He had two tubes of toothpaste. Okay, so one from left to right, then the other from right to left. Yeah, you're just wasting your money.
He had OCD.
Yeah, we say you need just a pea size, like a granite size.
Oh, okay.
So you don't need a lot. You need just a little. Enough for it to foam in your mouth. Okay, you need just a little. You don't need to put toothpaste all the way to the end. For kids, we say a smear. So something small on it, okay? Because these are chemicals. They may end up swallowing some. So something very small, okay, you are good to go. So you put just a little bit of the toothpaste on your toothbrush, okay? Then, so imagine this is your mouth, so your teeth. There are upper teeth and there are lower teeth, and we are going to brush them, okay? Previously, people would brush their teeth this way, left, right, left, right, left, right, left, right. And the teaching is that research has shown us that the more you do left, right, left, right, left, right, you wear the neck of the teeth, the part just between the junction where the teeth and then the gums meet. You wear it off and the teeth become sensitive. Then people said, okay, then let's do this. Up, down, up, down, up, down, right? So you do up, down, then you'll be pushing the gum away, exposing the root of the teeth. So that one too is not advised. So now we can't do left, right. We can't do up, down. So what can we do? We move in circles.
Okay.
All right. Now when you move in circles, the force with which you use is well controlled. Okay. So we say take about 2 teeth at a go and then orient your brush about 45 degrees to the teeth, and then just move in circles, about 3 or 4 circles, then you brush it down. Now when you do that brushing down, food particles that are stuck in here will brush it down for you. So you pick the next set, about 1, 2, 3, 4, you brush it down. You do same, all the way to the other side.
Okay.
All right. Then, when you finish, this is up, we haven't even gone down.
Oh, okay.
You come back, you come to the inner side of the teeth. And same thing. You do your circles, you brush it down. You do your circles, about 3 or 4 of them, you brush it down. You do likewise, all the way to the other side. Okay? So now, you've brushed the front, you've brushed the back, you are left with the top. Most of the time, we take our toothbrushes, we just do this, and then we go. You forget about everywhere. You need to take your time. Then go to the top. The top is the only part you are allowed to go in the traditional way, you know.
Yeah.
Okay? And then you brush here as well. Then you are done with the top. Okay? Then you move to the bottom. Then you repeat the same thing. About 2 teeth, you go in circles. This time, you brush it up. Same thing, you brush it up all the way to the other side. You go on the inside, you brush it out. You brush it out all the way to the other side. Then when you are done, you go to the tank. A lot of people forget to brush their tank. And that is one of the places that food debris stay, bacteria stay, and gives you bad breath. Okay? So you can use your toothbrush. You brush the tank. That one is from backwards to forwards, okay? There are also tank scrapers that you can use to clean your tank. If you don't have tank scrapers, you can use your brush. But if you have tank scrapers, use them. They are superior to brushes as far as cleaning the tank is concerned. So you can use your tank scrapers and you would see what will come out okay, you realize that, hey, I haven't been doing this thing well at all. So you do that, you see that the mouth looks really clean. Okay, all of this should take you 2 minutes. And we say for beginners, you should time yourself.
Okay.
Set your clock to 2 minutes. If it's not up, don't stop. Do it for a while until it becomes part of you. So if you are taking 2 minutes to brush your teeth every morning and every evening, you'll be able to do all of these as described.
Okay, so a follow-up question. I heard from somewhere that after brushing, you're not supposed to rinse your mouth with water. Is it true?
Yes.
And why?
So it's a brilliant way of keeping the teeth strong while saving you money. Okay, remember I said fluoride is good for the teeth. It goes to replace an iron and makes the tooth strong in the structure of the tooth. Okay, now for that to happen, it's good for the fluoride to sort of stay on the surface of the tooth for a while. So when you finish brushing your teeth, you spit out all the toothpaste in your mouth. We don't want you to swallow it, so you spit it out. What will be left will be that film of toothpaste that is still in the mouth, and don't rinse it, leave it there. What you have is fluoride bathing the tooth really well, and so that exchange will happen and the teeth will become strong. The other way to do that is to use fluoride mouthwash. But why spend money on fluoride mouthwash when you have the fluoride in the toothpaste? Okay. When you start doing this, it's uncomfortable. But with time, it becomes part of you. And we advise that do that in the evening, not in the morning. In the morning, it's uncomfortable. You are going to work, that sort of thing. But in the evening, when you are going to when you are going to sleep and you brush your teeth, don't rinse your mouth. Spit out everything and leave it like that. And allow it to bathe around the teeth throughout the night. And it will make the teeth strong.
Okay. Thank you. So another follow-up question. So for those who don't use toothbrush, but use, how do you call it, chewing sticks and plantain stalk and the others, do they have to follow the same process?
Yes. You see, those were what our grandfathers and our grandmothers used, okay? And it helped them. You see, in brushing your teeth, it's more of a mechanical thing. In trying to keep your teeth strong, it's a mechanical cleansing. Okay, so you need to get something that can brush the food debris and the bacterial biofilm on the teeth. And that's why you need a brush. Okay, so the plantain stalk and the chewing stick and whatever tends to do that action. And that's what our grandparents used. And they even added charcoal because charcoal is abrasive. So it also helps to get rid of stubborn stains. Okay. But the problem is that a lot of people, when they take the chewing stick, they just put it in one side of the mouth and they chew it. The idea is to chew the tip for it to become like a brush, so they can use it to brush your teeth. But they just chew it. They chew it, and they throw it away. So they don't brush their teeth. Then there's the sponge. The sponge, you're supposed to use your hand, move it around your teeth and clean it nicely. But they don't. They just chew it. Okay. So I will never say they are bad. But I think that in today's world, where toothbrushes are easily available and more convenient, why do you want to still go and use these stuff? Remember when you use the toothbrush, the chewing sticks and the rest, you don't use them with toothpaste. So you lose the benefits of the fluoride. Someone will say, well, I'll put toothpaste on it. That's fine. You can use that. Okay. That's okay. But why do you want to go through all of that stress when you can have your toothbrush, which is easily available? You can carry it anywhere you go nicely and then use it. Okay, that reminds me, I should have said this. When you take your toothbrush, you need to rinse it before you start washing, brushing your teeth with it, because you left it and you have no idea which insect settled on it when you left it. So there are even covers for if you have that. That is really good.
Okay, Dr. Juma, thank you. We are learning a lot today. I think we should be doing this topic more often. So we'll take a short commercial break. We'll take a short break, after which we'll resume and continue from where we left off. Welcome back. The topic of discussion is oral health, and the guest who is taking us through is Dr. Jima. Dr. Jima, welcome back.
Thank you.
So, to continue from where we left off, how does diet affect oral health?
Yeah, so it's extremely important, diet, okay? So for someone to get dental caries or a cavity, whatever, remember I said you already have bacteria in the mouth, and they live there, they are normal commensals. But sometimes they overgrow if you have bad oral hygiene and that sort of thing. And then they begin to destroy the teeth or the gum. So where do they get their food from to overgrow? The diet. If you take foods that are high in refined sugars, you end up giving these bacteria the right diet they need to be able to cause disease. That's why we always say if you eat too much candies, you have cavities.
Yeah.
Okay. Secondly, if the food you eat, those sugary foods are foods that easily stick onto the teeth, okay, then it means that the food will stay there longer, and so bacteria can act on it longer. So the diet that doesn't help oral conditions are those high in refined sugars. On the contrary, diets that help keep the mouth healthy and strong are diets rich in protein, in fruits and vegetables. Okay, and yes, some proteins as well. Fruit and vegetables, because you need, especially for the gum, you need like vitamin C to keep the gum strong. You need these vitamins for wound healing. So you need, and then to fight infections. Then also, those foods, fruit and vegetables, you know, when you are talking about digestion, we say eat foods that have roughages that will help in digestion. Remember, digestion starts in the mouth.
Yeah.
These foods that have roughages, they also have a cleansing effect of picking up food debris on the teeth so that you swallow it down. Okay. So they are also protective, okay? So the story will not change. We need a serving of fruit and vegetables every day. That's what we should be giving our kids. When we are thinking of lunch packs for kids, we should be thinking fruits and vegetables, not candies and biscuits and those things, all right? If we want them to have strong teeth. You'd realize that in the past, our parents were not, someone would say, our parents were not going to, our grandparents, what have you, they were not going to the dentist. They were brushing with sokodia, right? The chewing stick and all those things. And it seems they didn't have any tooth problems. First, I've said that they ended up having more of the periodontal disease where the teeth fall out. But they were not getting too much of dental caries because of their diets. Their diets were really complex carbohydrates. They were eating fufu and ampesi and banku and those things and a lot of fruit and vegetables straight from the farm. They cook it, they eat it. They were not eating a lot of candies. They were not eating a lot of refined fast foods, sweets, all these carbonated drinks and the rest. So their diet also protected their teeth a bit. But we want to look more Western, so we are also inheriting diseases of the West, and that's how come diet affects our oral health.
Okay. So please, let's talk briefly about mouthwash. Are they necessary, or are they tools for making money? So
that's a controversial one. That's a controversial one, and up till now, there are opposing thoughts on that. But I think it's clearly emerging that the consensus is that mouthwashes may not be as necessary as we thought they were. Okay, so when you are brushing your teeth, the mechanical brushing is the more important of the two as compared to the chemical cleansing, which is with what the antiseptics in the mouthwash will do. So if you are going to, and mind you, there are antiseptics in the toothpaste as well. So if you are going to take your toothbrush, put your toothpaste on it, and brush it really well like you should, okay, then you may not need a mouthwash. However, the argument is made that the mouthwash is able to enter places that a brush cannot enter. Now, those places, floss is made for those places. You are supposed to floss. So a floss is like a thread that you pass in between the teeth, the difficult to reach places for it to remove them for you. So if you are going to brush your teeth well and floss, you get a lot of those out. So the mouthwash becomes an additional thing. It's like belt and braces. Okay, you're wearing a belt and you've put on braces too. You just don't want your trouser to fall. So it becomes an additional thing. Mouthwash should not replace toothbrushing. If you brush your teeth well and you want to use a mouthwash, that's okay. But if you can't afford it, that's not a problem. If you are brushing your teeth well, you should be fine. Okay, a lot of the time we think that mouthwash will give us a good breath. It does, but for a few minutes, then it goes off. If you don't brush your teeth well, that bad breath will linger. If you brush your teeth well, the mouthwash becomes a top-up for you. Okay, so that is it with mouthwashes. Let me quickly add that everything I've said now is with everyday use of mouthwash. Okay, everyday use of mouthwash. However, there are some mouthwashes that are therapeutic, as in they are used to treat diseases. So, for example, you have gum disease, you'll be given a chlorhexidine mouthwash. That mouthwash is a drug. It's not something you should use every day. It is there to help the gum to heal so that the bleeding will stop. And usually we'll give it to you for 2 weeks. After the 2 weeks, stop. Because the concentration is too much for your teeth if you are going to use it on a daily basis. So those types of therapeutic mouthwashes, they are there. They are on, you should use them when they are prescribed for you, and when you are done, you stop. But the everyday mouthwash that you use after brushing your teeth, they are okay, but they are not imperative. It's not like you have to use them. If you add them onto your toothbrush, and it's okay. If you don't, it doesn't change much.
Okay. So what about chewing gum? Does it have any benefits for the teeth?
It does. It does. So gum has a way of picking up food particles that are stuck on the teeth out for you. Okay, anyone who likes chewing gum will tell you that it sort of picks the particles and clears them off. So yes, chewing gums are good. However, most chewing gums are sweet. So what is the sweetener in the chewing gum you are using? That is where the problem comes from. If the sweetener is a refined sugar, then you are compounding the situation. Okay.
Back to square one.
Exactly. But there are some sugars that the bacteria will not even act on it, and they are protective. One is xylitol. Okay. So xylitol. So now, if you check on chewing gums, you find that some of them have xylitol, and they write it boldly there that it has xylitol. The reason is that the sugar used here is a sugar that is a good one. Okay, so chewing gums with xylitol is what we usually recommend.
Okay, that's interesting. So, is there a correlation between poor oral health and a child's learning ability?
Poor oral health and a child's learning ability. What I can easily think about is that if a child has poor oral health, they will miss school. Okay. Because they have to spend time at the dentist doing fillings. And for us, some of our fillings, you come about 3 times for us to finish it up with you. Okay. The routine checkup I said we like to do it when kids are on vacation, so that it doesn't disrupt with their school services. And in most dental clinics, when we see children who are in school uniforms, we quickly see them so that they can go back to school. Okay, so if you consider time lost school hours lost because they have a toothache that has to be dealt with immediately and they have to come to the clinic, then there's a problem. Okay. The other thing that comes to mind is more like is the the oral hygiene or the oral health which is affecting their development. It is rather something that goes with it. So children who children who have special needs, okay, sometimes they are not able to brush their teeth well. They won't allow their parents or their guardians to brush their teeth well for them. So they will end up having dental diseases. Okay, so in dentistry, special needs is a very important area for us. And we need to do what we have to do for them so that they can still maintain good oral hygiene. Because if you don't and you say, oh, my son just will not allow me to brush their teeth, and when I try, they throw tantrums and those things, then they will end up with a lot of caries. Almost all the teeth can have cavities, and that becomes a financial burden. It becomes also a social one, because imagine a child growing up and they've lost all their teeth because they were so decayed that they had to be removed. They go to school and their teeth and those things will affect them. So that's how dental health can affect children and their health.
All right. So earlier you mentioned that the mouth is the gateway to the body. Does that mean that infections affecting the oral system, can they affect the heart, the other internal organs?
Oh yes. In fact, you would be surprised. Looking into the mouth, you can predict that patients have certain diseases that are not related to the mouth. Because a lot of the systemic diseases also show in the mouth. Okay, great. So people who have sickle cell disease, diabetes, high blood pressure, and sometimes people on certain medications. I'll give you an example. Some of the very common antihypertensives, I won't mention a name for a reason, because if I do, someone taking that drug will say, I'm not going to take it anymore, but you should. Some of these antihypertensives cause the gum to swell. Okay, and we will never stop you from taking that antihypertensive, because we know if you stop, you get a stroke. So remember when we started, I said there are some people who may have to see their dentists more often than others. So if you fall in that category, then it means you need to come for regular cleaning of your teeth, because your gum is predisposed because of the type of antihypertensive you are taking. So a lot of drugs actually have ways of affecting the mouth, and then some diseases as well. Okay. Then there is also the notorious one of infections of the mouth going on to affect the heart, especially in people who have prosthetic valves and those things. Because the thinking is that if someone has an infection in the mouth and there is a break in continuity of a blood vessel, that infection can seep through the blood and go on into the heart. And you know, heart valves can have deposit on them. And when they are prosthetic, the more the chances of deposits on them. So if someone has a prosthetic heart valve, for example, or any implant anyway, they can have these implants infected because they kept poor oral hygiene. So if you have a prosthetic heart valve, your dentist number should be on your, top 10 calls that you make.
You should post it on your wall.
Post it on the wall. Okay. The other group of people are pregnant women. Okay. Pregnancy has a way of bringing to bear everything that is hidden. And one of them is toothache. Okay. So your gums, the hormones, the pregnancy hormones, they get the gum to inflame, and that alone hurts. And if you have a cavity, it hurts worse than before. So if you are thinking of getting pregnant, please go see your dentist. In fact, in developed countries, once you're pregnant, you go to see your OBGYN, they will refer you to your dentist that go and have cleaning done so that midway you won't have problems. And if there are any fillings that has to be done, they are done early, because in the late stage, it becomes difficult to put you in the dental chair for hours because of the huge belly and all. So there are several of these that I can mention that predisposes to people on antipsychotics and anticonvulsants, people undergoing chemotherapy and radiotherapy, cancer management in general. So usually before someone undergoes these, they will send them to the dentist and say, have a look at this patient, and if they need any dental treatment, fix it before we continue with our work, because after the radio or the chemotherapy, it becomes very difficult for wounds to heal, and so it becomes difficult to do some dental treatments.
Okay. So it means that the reverse is true. Oral infections can affect other organs, and infection of other organs can also affect oral health.
So we say oral health is overall health.
Okay.
All right. It goes in both directions.
Okay. Okay. So a very important question: how expensive is dental care in Ghana?
So dental care is expensive based on how you make it. This is what people don't know. We say dentistry is not expensive or dental care is not expensive. Neglect is. Okay. It's like you have a car. If you service it, it seems as though you are throwing money away when you are servicing your car. But if you don't and it breaks down, the day it will break down, you spend all your money to fix it. Whereas if you were servicing it, it would be small money. Your engine will be in shape, your tires will be in shape, and you may never have to spend huge money on your car. So when dental diseases start, at those stages where they don't hurt, those are the best time to treat them, okay? And at those times, usually it doesn't cost much. And if you are on health insurance and you're attending a government hospital or a hospital that takes national health insurance, it will take most part of the cost for you. But as the disease progresses to advanced stage, the advanced stuff are expensive. And national health insurance doesn't cover everything. In fact, even the private insurance, not all of them cover everything. And this is even true outside the country.
Yeah.
Okay, so you wait for it to progress to that phase. Then it becomes more expensive. Then you also lose out on your insurance helping you. So when we say visit your dentist regularly, that is both a health advice and a financial advice too. You save money.
Okay. So do you think that parents, churches, schools, and even the government have a role to play in oral health education?
Everyone has a role to play. That's why I'm here. If I sit in my clinic and say, well, if you come, I'll treat you. If you don't come, it's your wahala. I'm not doing my work well. So we all have a role, okay? Let me start from parents. There's a concept. We call it the dental home. The dental home concept means that let your children see the dental clinic like a home where they feel comfortable. So parents who tell their kids, if you misbehave, we'll take you to the dentist, they'll give you an injection. Or even they'll take you to the nurse, to the hospital, they'll give you injection, please stop. What you do for us is that you make the kids scared of the clinic. So if they have to come and visit us, they're already scared, okay? So we say that before your child is 2 years old, they should have visited the dentist. Because at 2 years, their full set of baby teeth will be in their mouth. And make sure they visit the dentist. If not anything, on their second birthday, give that to them as their birthday gift. Take them to the dentist and let's look at all their teeth, okay? And then if there are practices we need to change, we change them. We'll teach them how to brush their teeth, teach you the parents. We say that when a child is below 3 years, they should have their teeth cleaned by their parents, their older siblings, their guardians. They shouldn't do it themselves. Okay. By the way, you start cleaning your child's mouth from day one. You don't wait for the teeth to come. So right from day one, you get a soft piece of cloth, soft or gauze or cotton, anything like that. You can just dip it in lukewarm water with just a little bit salt or just the water, and then use it to clean, especially the tank, because that breast milk, when it settles there, it's not good. It can also, bacteria can act on it. So you need to clean it, okay? So right from day one, you start cleaning the mouth of your child. When their first tooth comes, they can start using a toothbrush. But even if at that time the toothbrush is too difficult, you can still use the cloth for a while. You introduce the toothbrush simultaneously until they get used to it, okay? What I do with my kids is that, because when they were really young, they wouldn't allow you. So what I did was, I'll take my brush and I'll give it to them and I'll say, okay, you brush my teeth. And then they'll play around my mouth with it. And I say, then it's time for me to also play with you. And then they will allow me, okay? People have different things they do. Sometimes you have to think for them before. Do it. It's investment for your kids.
Okay.
From 3 to 6 years, they should be able to brush their own teeth under your supervision, okay? So sometimes they will make a mess of it. Allow them to make that mess. When they are done, then you brush all over for them. By 6 years, all things being equal, they should be able to brush their own teeth. So that is your role as a parent or as a guardian. If you are able to do this and also insist that they should brush their teeth every evening before they sleep, you've done very well for them. They will grow up with this habit to become part of them, and they will not depart from it. They will not have a lot of cavities to be filled, okay? So that's parents. Then comes governments, and then societies. We need to spend time to talk about some of these things, okay? And let everyone know that they are important. And then government also needs to come in with more dental clinics, more professionals, train more people in dentistry, so that we have dental clinics that are manned by professionals all over the place. These days, there are so many quacks around, okay? We need to have more of the professional ones so that our people can have access to good dentistry.
Okay. So it looks like there's more to talk about, but our time is up. And so your final words, but in your final words, you can throw a thing or two about people who do home remedies and self-treatment.
Yeah, so dentistry is one of those things that you would have to come to the clinic, all right? Home remedies may work to an extent, but you may have to come to the clinic. So when you have dental issues, please come to the clinic and let's take care of you. Home remedies give you relief for a short time. Then the situation gets worse, and then you have to come and go through more troubling things. So please, my last words, brush your teeth twice daily. The single most important thing you can do to protect your teeth, brush them twice daily. Use a soft to medium bristle toothbrush. Use a fluoride containing toothpaste. Brush your teeth for 2 minutes. Visit your dentist once every 6 months. Eat healthy foods, fruits, vegetables, and reduce the refined sugars, and you'll be all right.
Okay. Thank you very much, Dr. Juma. It's been very educative. Myself, I've learned a lot today. And I hope my viewers have also learned a lot. And we hope that when we call upon you again, you'll be back to give us more information.
Absolutely.
Okay. Dear viewers, thank you very much for tuning in. Remember to brush twice a day, floss daily. Remember that your oral health is a reflection of your general well-being. Stay tuned and join us next time for other interesting topics.